So it's non-psychoactive. Now, by that I mean it doesn't get you high. It's not really a shorthand for that, but that's what it does. It is. And the answer for CBD is it has very, very few side effects. I can't say it has no side effects, of course it does. But it's very well tolerated. It has very few side effects in its own right. If you do use a THC, the more THC, the more side effects, but we're not talking about THC with this Pureis, because it's a pure CBD. So how do you obtain it? Well, you can extract it from the plant, usually with ethanol or through a supercritical CO2 extractor. That's what you do if you want the full plant, so-called full spectrum product with all those cannabinoids and terpenes in. Or, of course, you can make it synthetically, which is what Chanel McCoy and Pureis product is made from. It's a synthetic CBD. CBD is exactly the same, it's just made synthetically rather than from the full plant. Synthetic CBD mimics the same CBD is found in as found in cannabis. It binds to the same receptors, it works exactly the same way, there's no difference at all. It comes into enantiomers. There's a negative one and the positive one. The positive one can have affinity with both receptors, have I suppose you could say, a mild THC effect. But if you make it synthetically, you can make it with a negative one, which doesn't have any THC-like properties at all. And that's one advantage of the synthetic, that you can make it with no psychoactive properties at all. And of course, with the synthetic one, there's no complications of the other cannabinoids or the other terpenes or flavonoids you get with the full plant. It's just pure CBD.
Just in terms, regulation is on the way. So Professor Barnes mentioned that there's this thing called novel food. It requires companies, so basically the European Authority, which subsequently the UK Authority followed, that CBD was placed on this novel food catalogue. So it basically means that companies have to do a series of safety studies to prove that the product is safe for long-term use. We as a company invested quite a lot of money in doing these studies with reputable CROs. They're all toxicology studies. They'd be very similar to what you'd have to do for a new drug entity. And I suppose the good news about this is we have submitted all of our data to Europe and indeed the UK Authority. The UK Authority now has published this list that allows that products that are on this list, they have assessed or they have seen the data, they've seen the safety data, and those products are authorised to remain on the market while they go through the full novel food process. So we're very pleased to say we are the first product to appear on that list. There's about 700 CBD companies operating in the UK. There is only 4 companies that are listed on this UK Authority list. So in terms of the trials we've done, so these were the trials initially to apply for novel food. Just to let you know, we are still doing clinical trials. We are now engaged in doing some efficacy trials in the area of insomnia, and this was kind of sparked by our real life data with products that are on the market. But just in terms of safety, because for a food supplement that is open to mass consumers, that's not subject to a prescription, it's important to know that your product is safe. So we did a lot of short-term and long-term safety studies. And I suppose the big ticket item is the long-term study, where we looked at our products over a period of time. We assessed various parameters such as clinical observations, mobility, reaction sensation, body temperature, histology. I won't go into it all, but I mean, literally everything was assessed to ensure that it's not toxic. And with that, then we were able to determine what is a suitable food supplement dosage that should be on the market. So we have products ranging from 10 to 20 milligram. We also did a lot of carcinogen studies, genotoxicity studies, and all of this proves that our products for long-term use is relatively safe at these strengths.
CBD is not in any way addictive, no propensity to that at all.